more information comes in about those who are getting the disease, it's very clear that it's spread out throughout the population, that a lot of the people who are getting infected are 40 or less, and certainly between 40 and 60. So we were wrong about that, and that's not unusual. I mean, it's very early in this epidemic, and so we're going to learn new things all the time. But clearly, we're learning that the disease is more widespread in risk than we thought.
So a couple of things. I totally agree with Dr. Satcher. And in fact, I want to highlight this morning, today, there's an MMWR. This is the weekly publication from the CDC describing the first preliminary description of cases in the United States. And what they see there is that although the case fatality is highest in people over the age of 80, the reality is about 40% of cases are among people 20 to 54 years old. So we need to remember, and those are pretty severe cases. Those are not mild cases. They're in the hospital, they're sick. So I want to emphasize that, first of all, probably people with compromised immune systems may not have a greater risk of acquisition. They have a great risk of complications, but anybody can have a complication. You could be a 20-year-old healthy individual who's a marathon runner in the best shape ever, and you can get this and have a severe complication. You're not immune from severe complications. So unfortunately, by saying that this is only about the elderly and the immune compromised people, the message is getting out is that, oh, I don't need to worry. I think we all need to worry.
Back to the phones here, and a question from Philip in Reno, Nevada. Hi, Philip.
Good afternoon. My question was, it has been reported that private labs do not need to publish results and demographics from the testing that they do. How does this affect the modeling and the ability for the government to track that?
Dr. Del Rio?
So I wish Dr. Messonnier was here, because now that is true. Initially, there was no requirement, but now labs, I think, are required to send their data to CDC, and they do it automatically. It's done electronically. We have done that HIV case, HIV testing reporting for years to CDC. So it simply requires it's a very simple thing for labs to do. So I don't think that's an issue anymore. I think the biggest issue continues to be access to testing, which is being scaled up, but is not yet where it needs to be.
You're listening to COVID-19 Hard Questions, Real Answers with Rose Scott at WABE in Atlanta. I'm Carrie Miller at Minnesota Public Radio, taking your calls and questions about testing. Dr. Carlos Del Rio is with us. He's chair of Emory University's Department of Global Health and co-directs the Emory Center for AIDS Research. And Dr. David Satcher is with us. He's a former U.S. Surgeon General and former director of the CDC. Rose, I'm going to go back to the phones here to Dorothy in Evanston, Illinois, with a question about being in a retirement home. Is that right, Dorothy?
Yes, it is.
What do you want to know?
Well, I live in a retirement home in the medical section that is inhabited by all people are well over 90 years old. 2 of those residents tested positive for the virus and were hospitalized. None of the nurses or caregivers were tested, and that's over 2 days.
All right.
And I want to know what we should do.
Dr. Del Rio?
Well, again, it's very hard to know why they were not tested. Were they not tested where there was no indication? They were not tested because there were not enough tests available. I want to emphasize with the limited access to testing that we have, the state health departments are trying to test the people that are sick. So testing people just for screening doesn't work very well. But what we need to practice is with those individuals that were exposed, they need to be put in quarantine. They need to be social distanced from other people. So in case they're infected, they don't transmit. Because again, as I said, just because they were tested negative today, that doesn't mean they're not going to test positive tomorrow. So I think that is at the bottom line. We have to practice social distancing. We have to stay away from people. 6 feet is a key distance to have. And again, hand hygiene. I want to emphasize hand washing. I'm a big fan of hand washing. Don't forget about it.
Dr. Satcher and Dr. Del Rio, often people say, you know what, you shouldn't look to the past, but the bottom line is there has been a criticism of this administration in terms of, did we start too slow? Why didn't we take this more seriously in the beginning? Maybe that doesn't matter now, I don't know, but Dr. Satcher, I'll ask you from a public policy standpoint, could we have prevented this number we have now in terms of at least confirmed cases?
Well, I guess I should begin by saying I really don't know, but I will say it is very clear that we have had opportunities to better prepare for this kind of outbreak. When I say we, it goes back not to just this administration, but earlier, things that we as a country could have been doing to strengthen the public health, to prepare better for this kind of outbreak. We have a shortage of ventilators. We have a shortage of ICU beds. And so it means that we haven't planned well. And we need to really think about that as we go forward. And hopefully it's not too late to really better prepare for the next such outbreak.
So I would agree 100% with Dr. Satcher, and I would emphasize that I think what we have here is we're paying for years of underinvesting in public health. And the fact that, for example, our public health departments, well, they can't do enough tests. Well, part of the reason is they don't have enough equipment to do the tests. They don't have enough personnel. CDC has had a hiring freeze for many years, and they are behind hiring almost 600 individuals. So again, underinvesting in public health is costing us today a fortune. And I think if there's a lesson out of this, is that underinvesting in public health is a really bad idea. As one of my mentors and heroes, Dr. Bill Foege says, quoting Dolly Parton, he says, "You have no idea how expensive it is to look this cheap." We have not invested in public health, and now we're paying big money because we did that.
Back to the phones to Rick in Des Moines, Iowa. Hi, Rick. Thank you for waiting.
My pleasure. I'm a little off topic, but I've been trying to get this question answered from a variety of sources. I did some research on the 1918 pandemic and saw that they really didn't get a handle on it until they started taking the blood serum antibodies from people